We can go ahead and get started. We have Mary Beth Hewitt with us from Shelters United. Like I said, I've been sick for 2 weeks and coughing, so I'm going to mute myself and she's going to take over from here. If anyone else comes on, I'll admit them. And if you're able to mute yourself, that would be great if you're not speaking.
Thank you so much, and thank you guys for the chance to come in and chat with you today. I'm going to share my screen in a minute and tell you a little bit about Shelters United. My name is Mary Beth Hewitt. I've been with Shelters United's parent company, Impex, for 21 years in February. We've worked on many different animal welfare programs. I am in the Northeast myself. I'm just north of New York City. I have two guys behind me. You can see Bubba and Mando. Bubba is our tripod pitty that we just rescued in May, and Mando is 4 years old. We rescued him just about 3 years ago now. So very involved in rescue and shelter and supporting you all. Shelters United is our newest program here. We are a group purchasing organization. So today I'll tell you a little bit about who we are and what we do for our members, and then answer questions that you might have. Feel free to interrupt me along the way. Jump in. We have a small group today, so glad to answer questions as we go too. So Shelters United is uniting to save pets' lives, saving money, saving lives, helping further missions. We are exclusively for animal welfare. So there are other GPOs out there that are for vets that shelters can participate in. We're only about animal welfare. Any nonprofits, municipals, clinics, TNR, anything that's tied to this mission is eligible to participate. We work on three kind of main pillars of benefits for y'all. Everyday discounted pricing, manufacturer discounts, and then learning and community. Our everyday discounted program pricing is a traditional GPO. It's a program that we established we started in 2019. We branded it in 2021. It's brought to you by INPEX, who's our parent organization, and MWI Animal Health. We're the two primary stakeholders. And it's a free program. There are no fees, there are no minimums, there are no hidden charges. It is a passion project for us. We're a pet and pet welfare agency, and that's how our company makes its money. But Shelters United is really our passion project. And we try to find the things that y'all need. So prices, prices and discounts and offerings on things like flea and tick preventative, and needles and syringes and rescue disinfectant and milk replacers, the things that you really need, whereas a lot of other GPOs are much more medicine focused. We also have a great service model. MWI has 22 warehouses across the country. Most things you would order from Shelters United would be delivered next day. We provide a lot of educational opportunities. So we want to show you what the products are. If they're products you're not familiar with, we generally have learning launches and education available on our website and in our email components. And our member consultant team works with all of our members one-on-one to answer questions. We also do a lot of educational materials and training, a lot of webinars, so that you all are comfortable with the products you're offering, how to use them, and then special offers and value adds from our partners as well. And then in addition to direct through MWI, which we consider like an everyday low price offering, and the promotions that come through MWI, we want to help find sources for things that are outside of MWI's catalog that you can't get there. So we are partnered right now with Wedgwood Compounding Pharmacy. They're the leader in the industry. Over 40,000 medication options. Shelters United members get a discount on office use meds. We are partnered with Heska to offer affordable POC testing. So right now we have heartworm, FELV, and FIV testing available. Those prices are significantly discounted over what you might find at MWI, and they are competitive with your three main carriers. So if you're using IDEXX or Zoetis, 10-minute read, no refrigeration, free shipping, great shelf life. And to date, about half of my members are purchasing from that. Some of our other partners you can see here, PRN, Pharmacal, Rescue Disinfectant, PetAg, Fear Free, Blue Buffalo has a natural vet diet line. We're partnered with Capinovet, which makes Provecta, Securo Surgical, and then some more community and learning-based organizations, including AWA, NACA, and Pet Finder. This is actually outdated now because just recently we've added TrackyPet and a couple, Myos is partnering with us now. So we're basically adding new partners pretty much every couple of weeks at this point, and we're expecting a big launch in 2024 for another 3 or 4 partners. Each of these partners provides special offers. And we communicate those things to you. We have a pretty hearty email communication program. So we're sending out emails once a week, maybe a little bit more often, depending on what's going on. But we're also, so awareness is key, right? But we're also, my member consultant team and I, Amy, David, and myself, are reaching out to our members, especially if we know it's a product you use or you're interested in saving on. We are calling and helping you make sure you're not missing out on things. Some of our recent and current offers, PRN Pharmacal, they do a lot of OTC gastro, and then they also have VPL sutures. So we did a buy one, get one free on suture in August. We did a buy one, get one free on gastro in September. We're bringing back suture in Q1 of 2024, along with some other opportunities with them. Pesca has some fabulous promotions. Most currently, we're doing a mix and match. 20% off their pricing, which is already better than everybody else's. And now we're getting an even better break through the rest of the year on those. Today, just a couple hours ago, we launched TrackyPet. They're a digital, like an Apple AirTag kind of thing, I guess. And Myos, we just launched. Parasite, short dated sales. So these opportunities roll, are constantly kind of cycling in and out. You know, some partners go on a monthly basis, some partners go on a quarterly basis. Sometimes they have a year-round offer, and then they add special promos on top of it. And we are constantly working to add to these offerings. I can take a breath and ask if anybody has any questions so far, or any, if I moved through quickly through anything. Okay. And then you'll see this verse up here. We're really excited because vaccine discounts has been something that we've not been able to bring to our members. And starting this month, as a matter of fact, probably going to launch in about 2 weeks, we're going to have vaccine discounts available to our members. So that's going to kind of, we're looking at it as the biggest, probably the biggest thing we're launching since we started Shelters United. And we're all very excited to bring it to the table because the pricing is better than most of the major manufacturer programs that are out there. So be kind of in tune to that. Learning and community I mentioned. So our website, this is a screenshot from the first page of what we call our blog. It's called Learning with Shelters United. And so you can see are regularly scheduling webinars. These 6 are actually all within maybe the past like 6 weeks or so, 8 weeks. And then all of those opportunities live on our website so that your teams can go back and, you know, if something you saw you think would be beneficial for everybody in your organization, you can go back. If you have a minute, I encourage you all to check out our championing, excuse me, change, which was also just posted on our Shelters United website. 2020, 2023 was kind of a milestone for us. We hit our 2000th member, and we did a 2K for 2K member drive. So from April until we hit 2000 in the beginning of October, everybody that joined was eligible to win. We did a random selection and gave a $2,000 donation to ended up being one of our members in Kentucky. So we did a blog style kind of interview with that winner, which was a really fun experience, and it has us planning to maybe do a podcast in 2024 because we had so much fun doing it. But we also have links to like the recent Pet Finder webinar about Meta. We're going to have a Pet Finder webinar, I believe, tomorrow or Thursday about grant writing. That'll live here. When we have vet webinars, that lives here. So all of this is geared towards sharing information with you all. So a little bit more than just sharing discounts. We also want to help you learn and take advantage of things in the community. So we're at 2,082 members today. In 2023, we're on track to save more than 4.5 million. Actually, I'm tipping around the 5 million mark, and I'm really hoping like I hope we make it. Excuse my language, because we thought we'd make 4 million in savings, and we've exceeded that to date. We're adding members probably along the rate of about 40 to 50 a month. And we know there's lots of room to go and to continue growing. We've also this year separated an MWI membership savings from some of our other opportunities like Heska Diagnostics and some of our direct sales opportunities. So we're trying to open up the savings to more than just people that have an MWI account or wish to have an MWI account. So we're hoping to bring our services and our resources to an even bigger audience with that change going forward. Ask me questions.
Hi, Mary Beth. What types of groups are eligible for membership?
Actually, anybody that is related to animal welfare, Leslie, in any way, shape, or form. So municipal and private brick and mortar shelters are eligible, rescue groups, foster networks, clinics, spay and neuter, TNR, transport. And recently, we have seen some community tied networks where human support groups are now branching over into animal support as well, animal welfare support. So if there's any tie to animal welfare, you're eligible.
That's great, thanks. And our group is mostly transport based, and we coordinate medical care mostly for a municipal shelter. So
Okay.
we have some of the supplies sent directly to the municipal shelter.
Yes, so each organization can have multiple shipping locations. We are, MWI is, waives any shipping minimum for primary location. So secondary locations would just be subject to a minimum order to control shipping costs, essentially. And it's reasonable. It's only $150 minimum for those secondary locations.
Great, thank you.
One of the things I didn't mention, and you may be kind of wondering, is vet, right? I don't have a vet on staff. I only have a vet of record. I don't have a vet of record because access to care has just been such a challenge in this current year. You don't have to have a vet on staff to start with. So if you have a vet of record and they're willing to sign for you, great. They don't have to be on staff. Once your vet of record was to sign for you, it works like a traditional distributor account. So you're not in a position where you need to be getting prescriptions or having your vet sign off on every order. Some vets like to be more involved than others, of course, but we don't want to add to their plate, which is often a concern for people. Like, I can't ask my vet to do anything more for me. So I like to assure people that we're not looking to place any additional burden on your vet, and they can be as involved as they want. or as not involved in as they need to be based on demands of time. But if you need to, you can also set up an over-the-counter account, which allows you access to a whole lot of stuff. You know, you don't need a vet to get standard vaccines. Rabies you do, but you don't need a vet to get your basic distempers. You don't need a vet to get quite a few flea tick preventative things, syringes, needles, gloves. There's a lot that you can do without a vet on record. So don't ever let that be a stumbling block or a concern.
This is Bob Tubbs. I have a question. We're looking at trying to set up for our people that have affordability issues with pets. We're approaching local vets in the area to do like a free day clinic type of thing, you know, and kind of move that around to different vet clinics in the region. So, you know, maybe for February, you know, Clinic ABC does this free thing for people that qualify through social services or things like that have pets. And they would, you know, if they do that and they do this service for free, we have dentists that do this kind of thing and all that kind of stuff. So if we can structure something like this, you know, having access to these kinds of this kind of service, you know, if it's going to be 200 vaccines that particular day or of whatever nature, or, you know, some dentals or stuff like that. How could a service like that intersect with you? So Clinic ABC decides they're going to do the month of February. We do a registration process. There's going to be 150 through the door type of thing, free service type of thing. Is there a way for us to engage into this possibility?
Absolutely. I think that we could do like a couple of things come to mind immediately. Of course, you're not limited, like I said, to sending an order any place. So if it's going to Clinic ABC for January's event, it can be shipped to Clinic ABC for January's event. Right there, I think is a help, right? Secondly, if you need to, I'm kind of thinking like we could set up a list. So if your event is a dental event, we always get X, Y, and Z. And then you get to a point where you just give me the quantity and we know what to order based on that quantity, for example.
Okay.
MWI has a great list feature that would allow you to take that kind of approach and build out a cart. I think that if, you know, we could talk further, but if the vet from that particular organization wanted to be the sign, you know, the sign off, we can add multiple vets to an account. So we have a lot of options to accommodate community-based events, Bob. I think we could absolutely work with you to set up a program that would be easy to manage. And that's the key, right? Easy to manage, that you don't have to recreate the wheel every time you go in. You have your list, it's 200. We do the multiplication and we order for 200.
Okay. And then if somebody wanted to underwrite some of this, obviously you're going to get the discount, but if there were community members that wanted to underwrite a project like this in some way, is there a mechanism for somebody to donate money or some resources to what you're doing here?
So we generally would advise you to set that up on your end and say, okay, it's going to cost X dollars for a pet. You can also, because your MWI does request nonprofits to pay via ACH, but it could be on a monthly basis. So if you're going to have X people, you know, if you're going to have a handful of people donating to underwrite an event, then that goes to pay that invoice and we can work that out as well. There are multiple payment ends on the back end. You know, we could set it up so that it doesn't get charged until after the event occurs and you can use the money to pay for it. We can work out some options on that too.
Thank you.
Mm-hmm. It sounds like a great program, Bob. I would really welcome a conversation with you further to see what we could set up, because I could see that being replicable for some of my other groups that are trying to do similar things.
Yeah, it was spawned by, we have a couple dentists here in the area, and once a year they have a free dental day. And, you know, people show up at their door at 4 a.m. in the morning, and they do 250, 300 people that heretofore wouldn't been able to have access to dental services. Mm-hmm. And so we have people that living at the poverty level or have some issues, and rather than give up their pets, if we can find a way to help them. We've already got kibble kitchens and stuff like that, so we already help with the food, but it would be great if we could help with the medical, because then they can keep their pets and they don't have to worry about not eating themselves. Meals on Wheels program, for example, has that, and that's been underwritten at a national level until at least next year, and it's been very successful.
I think, I'm thinking, even in terms of your community, we did a piece recently where it was like a foster kit list, and it was actually just a checklist of the items, and we know what that costs. And we use that to help people kind of put together foster kits. But I'm thinking that could easily be this is what you get to buy one pet type of list, right? And it links right back to the e-store for us. So we know what to order, what that person wants to support. I think there could be some nice offshoots for that. So
I'll reach out to you after this. I don't want to take the whole night, but
Yeah.
it would be great to know more about that. Thank you, Mary Beth.
Thank you. One of the things that we work on, as you're thinking about if Shelters United could benefit your organization, is price comparisons. So we will take and we'll look at, our foster kit is a great example. When we priced our foster kit out at retail, it was 21% more than our MWI discounted pricing allows for. And so we did this foster kit promotion over the summer, and we came back and we reran it in the fall. And when we reran the pricing, the retail pricing had increased like 9%, I think Marcy told me, but our pricing held. So, in today's economy where things are changing so rapidly and prices are shooting up every day. I mean, forget at grocery and retail, it's frightening. And I can't even imagine what y'all are facing in the vet space if you're buying these things at retail. So we definitely have the option to do comparisons for you. I also do comparisons against other vendors. So if you have your invoices from last month and you shoot them over to me, I can show you what we save on. But we don't just look at price to price. So if you told me you were buying Revolution, we're going to come back and we're going to say to you, Revolution is great. Revolution is Selamectin. Selamectin is also Celerid and Synergy and now Revolt. And so here are the prices for these three options. So we're always looking to show you savings brand to brand and active ingredient to active ingredient. MWI's house brand is Vet1. Vet1 has afforded our members somewhere in the vicinity of maybe 25% of our total savings, so nearly $1 million. We have comparable products to all of the basic major established products you would think of in the flea tick space, in the antibiotic space, in the surgical space. And so they just actually launched a Serenia comparable, in fact. And so we often help our members not only in savings on things that they're buying, but in helping you do some of that comparison shopping and on the ground research that you don't have time for because you're too busy helping animals, right? So because we're doing this at a broader scale and we're doing it at a national level, when people say, I need to buy this, odds are I've found that for somebody else already, and I have it at my fingertips. So we don't only want to be sending you emails, we want to be a resource for our members, and we are a resource for our members. So that's kind of the other part of a non-traditional GPO. Although we're a GPO, we're a group purchasing organization, we're not an average GPO. An average GPO doesn't have somebody working with you through resources because they're trying to keep bare bones and keep margins down. We have a team that is here to work with you and help walk you through these promotions and opportunities.
Another question, there's got to be price breaks at certain levels. So let's say, I'm getting $100 worth, but if I could get $150 worth, I would enjoy another 5% discount. So if I was to work with a neighboring shelter or rescue to up the orders so that we can all enjoy the extra 5%? Is that part of this equation?
Honestly, only thus far when we're talking about our short dates, and our direct sales. MWI is set up to be inclusive, so there are no minimums. Some brands and products have their own natural price breaks built in, and in that case, yes, but we don't penalize the little guys. Everybody gets the same treatment with us. And that's why I think we've been able to help a lot of smaller organizations that wouldn't otherwise have that kind of access, because most people put a minimum in place. Now, that's not to say that won't change in the future as we continue to grow, but we're working hard to keep a no minimum structure so that we're not precluding anybody from saving.
Right. And I'm sorry, last question. I don't mean to keep, but I've been reading about some vaccines being developed for cats for spay and neuter purposes. And obviously we have this virus that's kind of new. The media has gotten a hold of it, so it's had the effect of shutting things down. People are getting concerned about transporting pets and animals from here to there because of this. Would your blog be able to give us some guidance and about both the vaccine, this virus, and other things that might come up in this space?
So we haven't published anything yet. We're watching very closely, but it's changing very rapidly. In fact, the guidance last week is different from the guidance this week at this point. Colorado, which is kind of ground zero right now, we're keeping in close contact with some key members and some vets out there to keep us apprised of what they're advising, because that is seeming right now to set the stage for the country. Now, I saw an entirely different quote. I saw a piece on Morning Joe this morning that just had no information. So we are planning to issue something when we feel like the guidance is stable enough to share it with confidence. The other problem is that what we're hearing right now, the recommendations we're hearing right now are advising that you vaccinate for both flus, so a flu combo and a Bordetella, and there's an extreme shortage of influenza vaccines right now. So we don't want to add to that panic with the shortage of vaccines. So we're kind of trying to use a lot of caution in issuing guidance. Probably, honestly, what we'll do, Bob, is we'll just share feedback from AVMA or one of our other sources that and make sure that our members are aware. Trupanion did do a live on Facebook last week, and I can get you the link to that. But again, it's changing really quickly.
Thank you so much.
Mm-hmm. I that's a good question. It actually is something I want to kind of throw a disclaimer out there. I'm not a vet tech. I'm not a vet, and I don't have medical training. Our training is largely, first of all, it's experience based, and second of all, it's product based. So all of our partners do train us on all of their products, but we will always recommend, and if you ever ask me a question, if you ever called me and asked me that question, I'm going to tell you, go talk to your vet. I'll tell you what I know, but go talk to your vet, because we don't want to be giving out medical advice. The vet relationship that you all have is number one for us, and we try very hard to steer you that way, just because that's their job, and we want to make sure that you guys are doing what's best for your pets. So I'll just throw a disclaimer on everything I said by saying I'm not a vet, and I don't want anybody to not refer to vet whenever necessary. So how do you join Shelters United, right? Easily, you call me. I am probably the most accessible person you'll bump into. My phone number here is also text friendly. It comes to my desk. I work from home. Our team is all remote across the country, so we flex to work for hours when we needed. You guys are on the East Coast, I'm on the East Coast, that works out perfectly. And David Wasserman, who couldn't be with me tonight, is likely to be the member consultant for a lot of your organizations if you do decide to join us and work with us further. You know, he works with me and is one of my best member consultants, so you'll love him. He's very knowledgeable. He used to run a practice. He was a practice manager before he came to Shelters United, so he's got a lot of great knowledge. So we send, first of all, it's a no, there's no risk. So even if you signed up and there was one thing you saved money on and that's the one thing you wanted to buy, great. In general, when I've done price comparisons for organizations, on average, I'm saving them on 60 to 70% of what they're buying from other distribution sources. If you're buying from retail, I can pretty much promise you I'm going to save you on everything. You know, if you've got a great relationship in place with another organization or another distributor, perfect. Stay with them and buy from me what is going to save you money. No, it's not an all or nothing. So it's a kind of a win-win. But if you wanted to do price comparisons, you know, I'm always glad to answer questions on specific products and share pricing with you. So whatever you're comfortable with.
One other
Joining,
question.
oh, go ahead.
I'm sorry. You have the opportunity to tell us about trends in medicine just by buying purchases. You know, certain, like you said, Colorado, I would expect to be seeing an uptick of purchases of certain things as it relates to this virus, for example. But maybe in Virginia, it could be something else. So it would be kind of maybe as a future thing, and I know it's all resources and time to do all of this, but it would be interesting to know what trends are happening in different parts of the country, because we transport animals from those areas. And it would be nice to know that, oh, this one's coming from Ohio, for example, and it appears that Ohio is having a higher incidence rate of XYZ.
It's very interesting that you say that. We did we tested a promotion called Trending Discounts this year, where it wasn't a promotion, it was a communication. And we did just that. We kind of surveyed purchase data and we said, okay, this is what people are buying, what's behind it. And it was successful, and it was, you know, it worked the way we wanted it to work. It got people asking questions and we were able to help them. So we are looking at doing something like that. Probably starting later into Q1 of next year, because we need to now start to break it down, like you said, by state and region, but absolutely. And the other thing is that we can see those things. We have partnerships with so many of the major manufacturers, and we have partnerships at the vet level. We're working with the Shelter Vet and AVMA to create a vet of record program and to help share some of that medical knowledge down to our membership. And so all those pieces are coming together, and absolutely spot on, Bob. It's something we're working towards for Q1.
Thank you.
Thanks for the idea.
Thanks.
I want to pick your brain. You better call me when we're done, or later this week. It's a week. But yeah,
I'm always concerned about that, because each year there's a little bit less of it. So it's very easy to join. MWI's application is a page. We need a copy of your vet's license, a copy of your state tax, an ACH form. Our thing is a signature form to say discount my prices with Shelters United. It usually takes 3 days, 4 days. If you needed, you know, some people, if you have a spay and neuter, you may need controlled subs. That takes a little longer, of course. You know, there are ins and outs. Virginia is a premise state. What does that mean to you all? That means that if you don't have a premise license or an establishment premise license, we would need to ship to your vet, to a vet location.
in lieu of a premise, either stationary or mobile, we could use a business CSR, which just basically means that somebody's licensed by the state, and that can get you through to get things shipped directly to you. It's not a barrier. It just means that we might not be able to ship direct to you for prescription items if you don't have that in place.
I'm sorry, one other thought as you talk, I keep thinking of things. Working with at the state level with the state vets throughout the country with this service, and perhaps you may have already done the outreach, but you know, we've had some events with the state vet come down to the area, and you know, he shared some things that they were doing. Obviously, they manage the process of inspecting and making sure that the processes are being followed and all that kind of stuff. So if you haven't done it already, I'd encourage you to, you know, reach out at the state vet level. And
So
you
we're
know.
starting at the national level, that's step 2 behind the Vet of Record program. Step 1 was a survey, which was already fielded and we published the results. Step 2 is the development of the Vet of Record. And step 3 is actually, we're trying to work with national and state to source, help create basically a database of people that are shelter friendly to come work with y'all, so that you don't, so people that have that barrier of not having a vet to work with you can do that. And part of that would then become an educational component. We also are working with a company called Veterinary Teleclinic, and starting we're doing some discovery and research right now in some very small areas, because of course the client-patient relationship is something that's changing so rapidly. But the vet tele-advice and tele-triage is looking to become a really good way to at least get people the basics if they're waiting to establish that vet, if they have to wait 45 days to get into a vet, for example, which is unfortunately the reality in some areas right now. So in addition to VOR, we're hoping at some point in 2024 to bring a televet option to our members.
I'm sorry, one other thought. I hate to keep dominating here, but we had a situation here in the region about 3-4 years ago. It was a hoarding situation, a backyard breeder, I'm sorry. They had 35 dogs, standard poodles. They were just mass producing, selling them at gas stations and doing that kind of thing. And they all got picked up, and they needed a lot of help, especially medical help. We made outreach to a couple of vendors, and the next day they drop ship all sorts of vaccines for free, and do that kind of thing. So in those cases, having, you know, being part of the Shelters United family, it would be, you know, if there was some kind of mechanism that says this is an emergency type of thing, and these are the things that are needed in this case. You know, you see the stories, 100 dogs or 300 cats or 5,000, you know, dogs in Virginia last year. So with Cumberland County, so be nice to know that service is available to members. I think it would also attract members too, as just a thought.
That's a great idea. I'm going to put it in our list. We've tried to, you know, with 2,084 members, if we donated every time somebody asked us to donate, we'd be gone. So
Understand.
to date, we haven't been there. But we are growing, and we are starting to get into selling direct, and that's going to lead to direct distribution, which is going to mean we're going to have those resources to be able to do those things. So I do see it in our future. We're not quite there yet, but I do see it in our future.
Thanks.
And don't apologize, because you're asking questions probably that people are thinking of. So keep bringing them. But you know, it's these kinds of conversations, these kinds of questions are why we're here. it's my favorite thing to do, honestly. Like, I kind of consider it a challenge every time somebody gives me an invoice for a product and asks me for the best price. Like, it's my personal, I find it, I find it very fulfilling to support y'all, but I also find it fun to kind of solve those puzzles for you and help you save more pets, you know. So I would love to, I'm going to send some information over to be put on your website and shared with you. You have my information here, and I would love to talk to y'all individually, get you the paperwork and get things started, because we could have you all saving. We could have everybody save some money in December if we started now. Everybody could save at least a little bit. And I do have vaccines coming, and those prices are going to be not to be beat. So I want everybody to be available to, you know, ready to take advantage of those things when vaccines drop, for sure. Does anybody have questions? Does anybody have product questions? Or have you all heard of Myos, by the way? Has anybody heard of Myos?
No.
Have you used it?
No.
We just started partnering with them. I've heard really good things about it. And this big white guy on the screen behind me, Bubba, is a tripod who actually tweaked his leg over the weekend. So I'm kind of thinking I'm going to try it, but I've heard amazing things. One of my team members has an 8-year-old, Allie, who had ACL surgery twice now. And she put Allie on Myos this year, and she said it's made a tremendous difference. So I'm always interested in getting feedback on products like that from people. And if you didn't see it yet, if you're on our mailing list, you'll see today that we launched TrackyPet. That's another product that's new that we're very excited about. And if you don't have any more questions, I can give you all some of your time back. And if you have other, I don't know if you have other things to cover, Diana, tonight.
No, we don't. I just wanted to let everyone know that we are recording this and all of our most recent webinars that we've been doing. And if you go on our website, you'll find a link to our YouTube channel right at the top of the header of our homepage. And all of our webinars are being posted on the YouTube channel, and this one will be as well. And thank you, Mary Beth.
Thank you so much for your time this evening and for having me, Deanna. I look forward to hearing from you all, and you see my you know, reach out, email me. Wait, we have a chat here. Thank you, Leslie. Thank you for being here, and really look forward to working with y'all to save some money going forward.
Thank you, Mary Beth. Thank you, Anna.
Thank
Have a
you.
great evening.
Thank you.
Thank you.
Bye-bye.
Thank y'all.
Thank you, Bob, for all your questions. Kept people
Oh,
talking.
Well, I hope it helps.
It does, because some people just don't know the right questions to ask, but you were hitting all of them, so that was great.
Thank you. Thank you so much. Talk to you soon.
Bye-bye.
Bye.